and welcome! In today's session, we'll focus on LO1. Understand how measurement of health and social care provision informs services. We'll explore how data shapes the planning of health and social care, helping providers make better decisions and improve service delivery. Epidemiology studies how diseases spread and affect populations. It focuses on patterns, causes, and risk factors. Mortality rates measure the severity of diseases and compare death rates. Infant mortality is a key indicator of population health. Morbidity rates track the prevalence of diseases. Demographics study population characteristics like size and age. They impact healthcare planning and resource allocation. Age structure affects demand for services like long-term care. Geographic distribution influences service accessibility. Ethnicity and socioeconomic status highlight disparities. Birth and death rates reveal population health trends. Mental health data tracks conditions like depression. Mental capacity data informs support for vulnerable groups. These metrics guide social care planning. They ensure resources meet population needs effectively. ASCOF measures adult social care quality in England. It includes indicators like quality of life and safety. ASCOF helps local authorities improve services. It informs national performance reporting. Regular updates ensure relevance to policy changes. Mean represents the average value in data. Median identifies the middle value. Mode highlights the most common value. Percentages express proportions in data. Rates measure event frequency over time. Understanding these terms aids data interpretation. Consider patient treatment data over 6 months. Calculate mean, median, and mode for insights. Mean shows average patient numbers. Median reveals the middle range of data. Mode identifies frequent occurrences, aiding resource planning. Percentages show treatment proportions each month. Rates indicate monthly patient treatment frequency. These calculations help identify trends in healthcare. They support informed decisions on resource allocation. Understanding percentages and rates enhances data communication. Interpreting statistics requires understanding context. Recognizing limitations ensures accurate data use. Trends reveal patterns in health outcomes. Group comparisons highlight disparities. Being aware of statistical uses and abuses is crucial. Data guides health and social care planning. It identifies population needs and allocates resources. Performance monitoring highlights areas for improvement. Research supports service development. Data informs policy decisions for effective interventions. Demography influences health service demand. Age structure affects service types required. Geographic distribution impacts service accessibility. Cultural needs shape service delivery. Socioeconomic status determines service affordability. Demographic data predicts future service needs. Population size changes impact resource planning. Age profiles guide service allocation. Race and ethnicity data address disparities. Regional differences highlight access issues. Statistical terms clarify data in health research. Mean, median, and mode describe data distribution. Percentages and rates quantify health events. These terms aid in communicating research findings. Accurate use ensures data is understood. Patient data illustrates statistical concepts. Mean shows average treatment numbers. Median highlights central data value. Mode identifies frequent occurrences. These metrics support healthcare resource planning. Percentages express monthly treatment proportions. Rates measure treatment frequency. These calculations reveal healthcare trends. They inform resource allocation decisions. Understanding percentages and rates enhances data communication. Statistical interpretation requires context understanding. Recognizing limitations ensures accurate data use. Trends reveal patterns in health outcomes. Group comparisons highlight disparities. Awareness of statistical uses and abuses is crucial. Data is vital for effective health and social care planning. Understanding demographics and statistics informs service delivery. By interpreting data accurately, services can be tailored to community needs. This is the conclusion of the video. If anything is unclear or you would like more information, please contact us on WhatsApp at 074-843-61688. We appreciate your attention and hope to see you next time.